Thank you for joining us today. It's my pleasure now to introduce Chancellor Sam Hawgood.
Thank you so much, Gail, and welcome everyone to UCSF's first Earth Day Town Hall that we have convened in honor of an international movement to protect our environment that began back in 1970. Now, almost 50 years later, I am proud that UCSF is making great strides in achieving environmental sustainability across our operations. Just in recent years, our students mobilized to march at the climate strike to bring attention to what the Lancet called the biggest global health threat of the 21st century, and I would certainly agree with that. UCSF Magazine followed with a feature article titled "The Climate Crisis is a Health Crisis," spotlighting the work of UCSF faculty and staff and students to make this link more explicit. We have now launched the new Center for Climate, Health and Equity, which aims to harness the expertise of the health sector to drive climate action that prioritize the health, equity, and respect of all communities. And just last year, faculty from our program on reproductive health and environment established the multidisciplinary Earth Center to speed both the pace of discovery and prevention of environmental exposures that affect health across the lifespan. We will hear more about these centers in our first panel today. You will also hear about the various ways we reduced our collective carbon footprint as we reduced on-site activities in response to the COVID-19 pandemic. Among the sustainability silver linings to emerge is that due to the expansion of remote work, we saw energy savings and a reduction in travel emissions, resulting in UCSF emitting the lowest amount of carbon in the past decade. I am so grateful to UCSF faculty and staff and students, and in teams across the university to evaluate cost-saving opportunities and space efficiencies from telecommuting, telehealth, business travel, and operations. We'll hear more about some of those opportunities in our second panel today. Now, as we look ahead, we must prepare for the environmental consequences of climate change. You may recall that last September, the wildfires across California turned the sky orange, and the smoke affected the quality of air, leading to public health advisories urging people to stay indoors. Just this month, Governor Newsom declared a drought emergency in 2 counties in the state, which indicates more statewide actions will be needed to bolster California's drought resilience. The ongoing droughts, wildfires, extreme weather, vector-borne disease, and flooding all indicate that climate change is happening right now. With most of the state in its 3rd year of severe or extreme drought, we must prepare as individuals and as an institution for wildfires and related air pollution later this year. Now, while these environmental challenges affect us all, we must also recognize that disadvantaged communities already struggling with economic and health disparities have been and will be impacted the most by these climate change events. Experts will discuss this topic later in the town hall. The good news is that our national leaders are taking climate change seriously. On his first day in office, President Biden rejoined the Paris Climate Agreement. And last week, the Biden administration announced its aggressive plan to cut US carbon emissions by 52% by the end of this decade. So it's apparent that for UCSF to achieve our goal of carbon neutrality by 2025, we must continue to all do our part to create an environmentally sustainable, equitable, and healthy future. Now, before we hear from our panelists, let's hear from Gail Lee, our Sustainability Director, who guides and supports sustainability efforts across the campus and health system. Gail will give us an overview of our progress to combat climate change. I'm personally appreciative of Gail's passion and leadership in environmental issues at UCSF. Gail, over to you.
Thank you, Chancellor Hawgood, for supporting all of our efforts to achieve carbon neutrality by 2025 and allowing us to highlight our progress at this town hall. So I'd like to provide a quick overview of work across the campus and the health system and recognize the efforts of our 10 work groups, 4 committees, 1 student group, 2 task force, and more recently, 2 centers that we'll hear about today. The growing concern by UC students and faculty around sustainability issues often drive the UC Sustainable Practices Policy. In turn, we strive to engage the entire UCSF community to support actions to achieve those policies. This campus-wide engagement helped us achieve success around purchasing more sustainable food, Energy Star laboratory freezers, toxics-free furnishings for new and renovated buildings. We also promoted discounts on alternative fuel vehicles and have achieved the second highest waste diversion rating in the UC system. 2 challenging areas that we'll need to tackle are reducing our emissions from commute and business travel. And that's the areas that require support of the entire UCSF community to meet our goals. Our sustainability achievements around infrastructure include smart campus planning, green building certifications, energy efficiency, purchasing zero carbon electricity, water conservation, zero emission fleet vehicles, and EV charging stations. All these efforts require close collaboration with real estate, facility services, and transportation. So of the 10 policy areas and 85 sustainability policies, the carbon neutrality goal by 2025 to address climate change is the only one that requires us to mitigate if we don't meet the goal. This means we need to reduce our carbon emissions to zero by mitigating with carbon-free electricity, more energy efficiency, transitioning from natural gas to electricity, reducing our commute and business travel, and lastly, purchasing carbon offsets. Of course, we prefer not to purchase these, but use those funds toward education and research. So that's really where we need support from the entire university community. And we'll address this with a call to action at the end of this town hall. But first, let's welcome Brian Newman and Sheila Antrim, who will introduce each of the panelists. All of these panelists and speakers, there are just a few of the many dedicated staff and faculty who have contributed to making UCSF a more sustainable campus, and we want to recognize them for all their continued efforts. And just a note, if you have any questions, put them in the questions in your Q&A box with specifically who you'd like to answer that. And then we will post most of these on our website, so be sure to check back on Friday. So now I'd like to introduce Brian Newman, Senior Associate Vice Chancellor of Real Estate and co-chair of UCSF's Advisory Committee on Sustainability. He will also introduce our panelists.
Thank you, Gail. I'm thrilled to report that UCSF continues to plan our campuses with climate resiliency and our carbon neutrality goal in mind by designing energy efficiencies beyond the building code in our new buildings and renovations, avoiding the use of natural gas, securing carbon-free electricity, and conserving water. Next slide. In fact, we have already installed solar panels on 9 buildings, generating enough energy to power 407 California homes a year. In 2020, 97% of electricity purchased by UCSF was carbon-free. This was possible by purchasing electricity from Clean Power SF, the UC Clean Power Program, the Western Area Power Administration, and of course, PG&E. We also have a multi-year partnership with PG&E that has funded 28 energy efficiency projects, saving UCSF enough energy to power over 18,000 homes a year. Next slide. Since 2009, UCSF has built or renovated 24 major construction projects focusing on energy and water efficiency, drought-tolerant landscaping, water-efficient fixtures, and healthy interiors. They are all required to be certified LEED Silver or better, but our goal remains LEED Gold or better. Amazingly, through energy efficient, greener new buildings and other strategies, our energy carbon emissions are almost back to 1990 levels, despite increasing our square footage 2.5 times. Going forward, to meet research and patient care needs, our project managers are working on many new campus and health capital projects, from renewal of aging building systems to elevator replacements to a new hospital at Parnassus Heights. To comply with UC policy, all these projects will incorporate strategies for energy efficiency and electrification. Looking beyond our current accomplishments, we have 3 panelists to share how we are incorporating climate action into not only our campus planning, but into academics and research. Our first panelist is my UCSF real estate colleague, Alicia Murasaki, Assistant Vice Chancellor for Campus Planning and our campus architect. She will discuss campus-wide planning and ways we include sustainability to ensure a more resilient campus. Next is Ariane Tehrani, Professor of Medicine and founding co-director of UCSF's new Center for Climate, Health, and Equity. She will share the vision and pillars of the center and their 2021 initiatives. And our third speaker is Anne-Marie Charlesworth, representing UCSF's newly funded Earth Center, who will share the implications of fossil fuels in addressing environmental health issues. Now, let me turn it over to Alicia Murasaki, who will talk about our baseline conditions, present focus, and future plans. Alicia.
Thank you, Brian, and welcome everyone to our Earth Day Town Hall. I want to advance the slide, please. I want to give you a little bit of context. So the University of California has policies to which UCSF is responsible for. And there are many areas where our UC policies actually exceed California codes and national standards such as ASHRAE. Just a few examples are that all our new buildings and major renovations must exceed the California Building Energy Code efficiency standards by 20%, and we always strive for 30%. Our acute care facilities must exceed ASHRAE by 30%. And LEED Silver is a minimum for new buildings and major renovations, but as Brian mentioned, we always strive for gold. Our laboratories also must work with the laboratories for the 21st century. And since 2019, no new buildings or renovations can use new on-site fossil fuels for water or space heating. Next slide, please. So that's the context. But let me give you a few examples from the great work that's happening right now. There's a lot of focus happening across all of our campuses and across many of our campus departments. And so these are managed by teams from real estate, as well as campus life services and many others. Our comprehensive Parnassus Heights plan looks to decrease our carbon footprint by decreasing commuting needs. And we plan to add 732 housing units in Parnassus Heights, which would bring the total of up to over 1,200 housing units. In Mission Bay, our Block 34 design is completing, and it will be an all-electric, all-clean power building, including solar, thermal, and daylight sensoring. In addition to meeting the required LEED goals, they're also innovating by setting and exceeding some EUI goals. They're looking at embodied carbon analysis to reduce the building's overall carbon footprint, which includes all the embodied carbon in the materials used to build the building. They're also using a triple bottom line analysis, which not only evaluates carbon emissions, but also greenhouse gas emissions of the design building systems and its life cycle implications over the life of the building. And of course, we can't forget about our existing buildings. We estimate that we'll save an additional 3 million kilowatt hours annually from the 8 ongoing strategic energy partnership projects. This will be added to the 28 we've already completed over the past years. And I want to give a shout out to Tidelands. It is our first all-electric buildings. We recently achieved LEED Gold status, and even down to the details like the recycling chute system has been a success, which encourages occupants to change their behavior and recycle appropriately. Next slide. Now our future. So we've accomplished a lot, but we're not resting on our laurels. At the scale of the campus, we are launching a resiliency plan, which uses the lens of social justice in the planning effort. And I hope that we'll be talking more about this in the future, as this effort is a multi-year effort and it's just getting started now. We're also starting to work on a bicycle and micro-mobility plan for our campus areas, because we want to encourage people to get out of their cars, whether it's their total commute or even if it's just the last mile, make it easier for people to use bicycles and other micro-mobility options. We're continuing the Mount Sutro Vegetation Management Plan to ensure the health of the forest that's been entrusted to us. We are, as Brian and Gail mentioned, living up to our commitment to 100% carbon-free purchased electricity by 2025, and we're well on our way to meet this goal. Now let's zoom into the building scale. We design our new buildings to be all electric. This will include the Parnassus Heights Research and Academic Building and the Aldea Housing Densification Project, which we're beginning to study now. The new hospital at Parnassus Heights is targeting a whopping 40% energy use reduction, which even exceeds the UC policy of 30% reduction. They're also using the Living Buildings Challenge to focus 90% of the building materials selected to support human health and well-being, making it a truly healthy building. And again, our existing buildings, we're developing projects for rainwater capture and reject water recovery, among many other initiatives. These are just the highlights, and I have to say it was really hard to scale this down to the few minutes I had to talk to you. And I want to introduce our next speaker, Ariana Tirani, the Professor of Medicine, Division of General Internal Medicine in the Department of Medicine. She is the co-director of the UCSF Center for Climate Health and Equity, and she represents UCSF on the faculty engagement pillar of the UC President's Global Climate Leadership Council.
Thank you, Alicia, for the introduction, and thank you to Gail and her team for the opportunity to speak about the Center for Climate Health and Equity on behalf of myself and my founding co-director, Sherry Weiser. So as Chancellor Hawgood highlighted for us, the climate and ecosystem crisis impacts every health pathway as we know it, and the crisis is very much already here. In their 2019 countdown, the Lancet notes, and I quote, that a child born today will experience a world that is more than 4 degrees warmer than the pre-industrial average, with climate change impacting human health from infancy and adolescence to adulthood and old age. As an institution whose mission is to advance health worldwide, we at UCSF feel compelled to not only act, but to lead on the climate and health front. We have launched a transdisciplinary climate and health center to enhance knowledge and build momentum and promote equitable and just solutions at the nexus of climate change and health. The center is focused on the 4 pillars that you see here. Through our research pillar, we have established a design-based, solutions-focused body of evidence that fills critical evidence gaps in the climate health pathways. Our education pillar, we have enhanced the training for all of our health professionals across campus and the public on climate health links by developing cutting-edge pedagogies, offering continuing education and mentorship opportunities, and really working with clinics in our patient care to enhance education there. Our health system sustainability pillar, which really is a unique part of our center that makes is quite different from other similar centers nationwide, plays a key role in devising climate smart health systems, advancing climate medicine and patient care settings, and improving the readiness for local climate health disasters. And finally, our policy pillar leverages research and education to translate evidence into environmentally sound policy. And we are working with community organizations and non-governmental organizations across the globe to help ensure this happens. Next slide, please. Here are a few of our current up and running initiatives. We have a number scheduled for the future as well. We are running a climate and health colloquium with the School of Medicine's Population Health and Health Equity team. Our next series is on May 20th, and it's going to be focused on climate and health justice. This week, actually, we're steeped in this as we speak. We are hosting a University of California-wide, California state-wide climate justice symposium for transforming education, which explores how to integrate climate justice into higher and health professions education. And in the next couple of weeks, we will be launching a climate and health works in progress to bring the UCSF community together working in this area. Thank you all. And now let me introduce our next speaker, Anne-Marie Charlesworth, Director of Community Engagement Core of the UCSF Earth Center. She also represents the Earth Center on the UCSF Advisory Committee on Sustainability and is a close collaborator with our Center for Climate Change and Health and Equity.
Thank you so much for the introduction, Ariane, and thank you, Gail, and really everyone on this call for this wonderful opportunity to participate in this historic event. The next slide, please. So again, I'd like to give you a little bit of context for the Earth Center. The overexploitation of fossil fuels has been linked clearly to the catastrophic climate events we are now experiencing. Next slide. But less obvious is the fact that fossil fuels are responsible for the chemical pollution we are seeing on our planet and in our bodies. Next slide. Plastics, some pesticides, flame retardants, and perfluorinated compounds, which are all endocrine disrupting chemicals, are derived from fossil fuels, and they are found everywhere around us and in us. Next slide, please. The production of these chemicals, which has steadily increased since the 1950s, corresponds to a dramatic increase in the incidence of obesity, diabetes, fertility problems, cancer, and neurodevelopmental disorders. Next slide. Moreover, these chemicals are entering our bodies before we are even born. Our research has shown that babies are being born pre-polluted. In a study just published on March 17th of this year in the Journal of Environmental Science and Technology, Earth Center scientists use new technology to detect 109 chemicals in pregnant women and newborns, including 55 chemicals never before reported and 42 mystery chemicals whose sources and uses are unknown. These chemicals include PFAS, pesticides, plasticizers, and those found in cosmetics and industrial sources, including building materials, flooring. Again, all byproducts of fossil fuels. And other rare conditions affecting our pediatric population, such as cancers and autism, have been steadily increasing. Teen cancer was up 25% from 1975. And autism, which was prevalent in 1 in 5,000 children in 1975, is now affecting 1 in 68 children. Next slide, please. The mission of the Earth Center is to research and document how these chemicals, many of which are derived from fossil fuels, are impacting human health across the lifespan and across the globe, and use science to advocate for policies that protect and promote human and planetary health. Next slide, please. So, how do we accomplish this? We're creating opportunities for new research and transdisciplinary collaborations in environmental health at UCSF. We're embedding environmental health literacy within healthcare, and we're mentoring and growing the next generation of research and clinical leaders. Thank you.
Thank you, Anne Marie. So I'd like to thank Brian, Alicia, Ariane, and Anne Marie again. You made us realize that the complex ways how we operate and impact the climate and how the climate impacts us. And now let's invite all the panelists back to answer a question from the audience. Okay, all right. So the question is, how do you see your programs collaborating with one another? And can you keep your answer to maybe 2 minutes? Because we're running a little bit behind. So why don't we start with Alicia?
Well, I think just like natural systems are complex and interrelated, the solution to our climate crisis is equally complex and interrelated. So I'm really excited to learn firsthand about some of the things that the scientists are looking at chemicals, because that directly relates to building materials. And I think that's someplace we could collaborate on. I'm looking forward to that.
Great, thank you. Anne Marie?
Yeah, I completely agree, Alicia. It would be wonderful to, I think we have a lot of opportunities to, inform, use the science to inform some of your work, but also learn from you in terms of what you're considering and give you some more, be responsive. The other thing I think we can do is through our stakeholder advisory board in the Community Engagement Corps, work with you to give, to provide some community-based feedback around that, through that lens of social and environmental justice, as they really inform our research priorities. So I think that's another opportunity.
Great. All right, thank you, Anne Marie. And Ariane?
Yeah, this is a great question, Gail. I have to say, for change to be everlasting, we know that it really has to be a systems and comprehensive approach, which is very much needed. And I think the collaboration of groups all along campus are very important to the systems approach to change. And, the Earth Center is already a close collaborator with us, although we focus on slightly different domains. The underlying root of the problem that we are trying to address, the human impact on the environment, either in the form of toxins or the form of ecosystems change, is similar. And I think that really working together really helps take that work forward. Anne Marie mentioned very nicely the role of the stakeholder advisory group that the Earth Center has. And I also want to acknowledge that she has been leading and pulling together a group of students for a student advisory board for both the Earth and the Climate Change Health and Equity Center that have really been very, very instrumental to helping us plan for the future of the center. And so I'll stop there.
Okay, great. Well, thank you all for your thoughtful answers. I can see that this is just the beginning of more collaboration, and we're excited to see the long-term impacts of your work in the coming years. So now I'd like to introduce our other co-chair of the UCSF Advisory Committee on Sustainability, Sheila Antrim, Senior Vice President and Chief Operating Officer of UCSF Health. Sheila?
Thank you, Gail. During COVID-19 and our journey, we've seen staff rise to the occasion, use their creativity to find solutions to problems we didn't anticipate. Given the continuously changing conditions, staff went above and beyond to pivot and adapt. In addition, the campus and health system found many opportunities to work together, collaborating to fill voids and provide services wherever needed. Next slide. Some examples of that collaboration were the Emergency Operations Center, our vaccination stations, and health screening stations. Lessons learned from these partnerships have made UCSF stronger, more sustainable, and more resilient. We also found sustainability silver linings in surprising areas. Even though we don't expect some of these silver linings to continue, there were lessons that we could use to make lasting and beneficial changes to mitigate climate change and protect our environment. Next slide. One example was the pivot from disposable isolation gowns to washable isolation gowns. A washable gown pilot was conducted a few years ago, showing savings, cost savings and waste reductions, but it wasn't adopted until the shortage of disposable gowns occurred in 2020, which made it an imperative. The purchase of a total of 30,000 washable gowns is shown to be a wise decision and investment, as disposable gowns have since tripled in price. And we've estimated a savings of about $500,000 a year and reduced tons of waste with this switch. Next slide. Now I'd like to introduce our second panel of speakers who will share additional silver linings observed during this time of COVID-19. Our first panelists are two medical students, Colin Balin and Stephen Ettinger, who, in an effort to reduce admissions from business travel, explored faculty motivations to travel through a series of focus groups. Next up is John Rosendo, our facilities energy analyst who tracks and reports UCSF carbon emissions from UCSF operations. He will provide his observations and energy and utility savings over the past year. Our third panelist is Dr. Linda Brannigan, Director of Telehealth Resource Center, who will share the remarkable adoption of telehealth, a service that was slow to adopt, but took off within the first week of shelter in place. Let's welcome Colin and Stephen to tell us more about their projects.
Thank you, Sheila. Stephen and I are honored to be here and part of this inaugural Earth Day Town Hall. And while it's us that you'll be hearing from today from the students, there are dozens of students at UCSF interested in creating awareness around these issues. Today, Stephen and I are here to talk about some work that we've been doing alongside our faculty mentors, Dr. Catherine Gunling and Dr. Sarah Ackerman, and really talk about some steps we could take as a university to reduce the carbon footprint of UCSF with an eye towards trying to mitigate the significant emissions that are still generated from academic and business travel. As this audience is well aware, the climate health challenges that we're facing really amount to a crisis. Wealthy countries like the US and its wealthiest citizens and corporations are contributing disproportionately to the problem of climate change. And it's really vulnerable populations in the US and those living in resource limited settings around the world that experience the brunt of the consequences from these changes. The US is the second biggest emitter in the world, and the US healthcare sector has been estimated to account for about 10% of these emissions. You can go to the next slide, please. At UCSF, we're hearing about well, today from many champions around these issues about the great strides we've been making as a university and as an institution to reduce our emissions. But travel from business and academic purposes is still an increasing area, an increasingly problematic area, in both an absolute and relative sense. With the exception, of course, of this past year. As second-year medical students, Stephen and I had the opportunity through a Carbon Neutrality Initiative fellowship to go at this problem. And our initial approach was to try and mitigate these emissions through a university-wide carbon offset program. This was just getting off the ground when the pandemic hit. And with the halting of global travel and not much travel to offset, we, alongside Catherine and Sarah, had the opportunity to reconsider our approach to this problem. And we realized that while carbon offsets certainly help, and we should, is a solution we should be thinking more about, they're also really a bridge to carbon neutrality. And what we realized was that what we really could do to reduce our emissions was to reduce our travel. And to do this, we had to better understand the systems and incentives that were driving this travel at our university. Next slide, please.
Thanks, Colin. So Colin, myself, and our faculty mentors set up a series of focus groups last summer that examined the motivations and experiences that faculty have at UCSF with academic travel and how things had changed during the first half of the pandemic. We found that people have a lot of unclear messaging from their leadership about how much travel is really necessary or expected for them to advance in their careers. And this has led to an arms race of sorts where faculty feel pressured to constantly be seeking out professional opportunities that require travel. We found that senior faculty tend to travel more often, and this sets a precedent for junior faculty. And this perceived need to travel creates complications with both clinical and research time, as well as domestic obligations like childcare. And it sets up this conflict between the sustainability policies that we're talking about today and the institutional aims that we have of disseminating knowledge and supporting healthy communities. The faculty that we spoke to were amenable to change in our travel culture, and there's also good data to support that this is not unique to UCSF. Next slide, please. So how can we create a more sustainable future as we emerge from this COVID-19 pandemic? We believe that we need clear guidance from leadership about when it's appropriate to opt out of travel. And while our IT resources at UCSF are excellent, we should bolster these and lean on their expertise so that the UCSF community has access to both the latest techniques and robust virtual platforms that allow us to engage with our colleagues all over the world in a really meaningful way. And when we support blended format meetings that allow participation both in person and virtually, we enable a more inclusive and diverse participation within our academic and medical societies. We think that we need a better way to track how much travel we do as a university so that we can meet those 2025 carbon neutrality goals. And until better technology is available, as Colin mentioned, we should be offsetting the travel that we do participate in. So thank you, and we'd like to introduce our next panelist, John Rosendo, a campus energy analyst from Facilities Services, to share our utility savings during COVID-19.
Thank you, Colin and Stephen, for the introduction, and thank you to the Office of Sustainability for inviting me here today. I'm part of the energy management team in Facility Services on the campus side, and our team works on clean energy procurement, energy and water efficiency projects, and we also help develop strategies for our carbon neutrality goal and other energy and water reduction goals. Today, I'm going to focus on some of the energy and water savings that we saw during COVID-19, and also highlight some of the efforts that we did to conserve energy. Next slide, please. So last year in mid-March, we started to see low occupancy on campus due to the shelter-in-place ordinance. Many of us transitioned to remote work at that time. And Facility Services identified low occupancy spaces and the system that served those spaces. Many of our buildings were running on normal operating schedules, and we were heating, cooling, and ventilating spaces as if they were fully occupied. Our goal was simple: conserve UCSF resources by turning down systems that use energy and water in unoccupied spaces. And our target areas were conference areas, classrooms, retail, fitness, and other administrative spaces. Laboratories and research and healthcare, which make up the majority of the buildings at UCSF and also make up the majority of the energy use at UCSF, were not part of this effort because they were either partially or fully occupied, or fully operational rather. And we focused on heating, cooling, and ventilation systems. Next slide, please. So here's a look at our energy and water savings, energy being electric and natural gas, as well as water for the UCSF campus. And right here, these graphs are comparing 2019 monthly consumption, which is the lighter color in the back here, to 2020. On average, we saw an 8% reduction in electric, a 9% reduction in natural gas, and 11% reduction in water across campus. These graphs do not include UCSF Health. Not surprisingly, they did not see the energy reductions as they were fully operational last year. They did, however, see some significant water savings in their outpatient clinic buildings. Next slide, please. So here is an example of a building that covered most of our target areas. And we were able to be a bit more aggressive with our turn down effort here. This is the Rudder Community Center, which is located on our Mission Bay campus. It contains a mix of conference, fitness, food court, and office area, as well as some clinic spaces. And we already started to see some reductions in specifically water use and energy due to the fitness, conference, and restaurant closure. In facilities, we were able to take additional actions, which included turning off heating for indoor and outdoor pools. We set back and turned off heating, air conditioning, and ventilation in most of the spaces, and also turned down heating and hot water set points, which enabled us to save a substantial amount of natural gas energy. Next slide, please. So here we are looking at the Rudder Community Center alone. And Similar to the previous slide, we're looking at 2019 compared to 2020, and we saw an average reduction of 31% in electric, 65% reduction in natural gas, and a 70% reduction in water use at Rudder Center. You can see in April and May, during the height of the shelter-in-place ordinance, we had a 93% reduction in water. And total energy and water utility cost savings at this site was $300,000. Across the whole campus, it was about $1.8 million. And just to close here, given UCSF's research activity and the health focus, it's not surprising that the overall savings was not extremely significant because our critical research in healthcare continued. However, non-research and health buildings where we were able to turn down more aggressively, we did see significant savings. Next slide, please. And now I'd like to introduce Dr. Linda Brannigan, the director of the Telehealth Resource Center, to share her work on telehealth and sustainability.
Thank you, John. I'm very excited to talk to you about telehealth and sustainability. I think there's a great story to tell here. I also want to acknowledge Candace Corder in the FPO office who did much of the data analysis that I'm going to share. Next slide, please. So as I'm sure many of you are aware, there's been a huge jump in video visits at UCSF since the pandemic. In January and February 2020, we did fewer than 200 video visits a day. And relatively speaking, that was a lot, sort of compared to our national peers. And then shelter in place was declared and we jumped up to 2,800 a day or something. And we've stayed in that range pretty steadily since then. April isn't over yet, but it's actually shaping up to stay in this range as well. We're fairly unique in that regard. Not every institution is reporting this maintenance of high utilization of video visits. Next slide, please. So this is a heat map of kind of where the patients that we've done video visits with are. This is just California and Nevada, and the regions that are depicted are zip codes. So you can see that we've seen patients in every county in California in the past year and in quite a lot of Nevada. Next slide, please. And we didn't just stop at Nevada. Due to various states reducing the barriers to care via telehealth by physicians who are licensed in other states, we've been able to see patients all over the country. And thanks to that one patient in West Virginia there, we can say that we've seen patients in all 50 states in the past 13 months. That's over 13,000 visits in total. And then not shown here are over 34,000 clinical phone calls made to patients outside of California as well. Next slide, please. So if you put that all together, the travel avoided by video visits in the past year results in a net savings of almost 22,000 metric tons of carbon dioxide, which is an astonishing number to me. It's equivalent to the greenhouse gas emissions from over 55 million miles of driving a car. Also an astonishing number. Like that is like more than half the distance between Earth and the sun, right? That's just huge. Also equal to, almost 500,000 miles of gasoline consumed and the carbon sequestered by 26,000 acres of forest. Really, these are huge numbers that we were definitely not seeing before the pandemic. Next slide, please. The tricky thing is that it might not actually continue. A big part of the reason we've seen this enormous growth, not just at UCSF, but nationally in the use of video visits, is that Medicare began to reimburse for them when the patient was located in their home. And they did that in response to COVID. And while the Secretary of Health and Human Services can make a temporary change in the face of a public health emergency, it will take an act of Congress to make this permanent. Congress has noticed this, and there are dozens of pieces of legislation either that have been proposed or that will be proposed this session that aim at that permanence in one way or another. So we're crossing our fingers, but it's a thing that we'll need to have happen. Also, states, as they end their own public health emergencies, will begin to reinstate those barriers to care across state lines. Congress could also act to address this, but it's not quite as politically attractive as the reimbursement picture with CMS. So these are two things that are very active. There's bipartisan interest in them, and we will continue to track them really carefully. But this change was such a huge driver of telehealth adoption nationally. It's really going to need to stay for us to continue to see what we're seeing. And with that, I will pass it back to Gail.
Okay. Thank you, Linda. And thank you, Sheila, Colin, Stephen, John. Amazing work and so much to think about to make the changes that we need to see. And now let's invite our four panelists back to turn on their cameras to answer a question from the audience. So if you knew then what you know now, what should we have done differently, or what should we do in the future? And please keep your answers to 2.5, 3 minutes. So Stephen, you want to go first?
Yeah, sure. Thanks, Gail. I guess Colin, myself, and our mentors, Dr. Gunneline and Dr. Ackerman, are really thinking about creating a fundamental change in travel culture in the future. And we believe that this is something that we can do as we emerge from this pandemic, and using it as a pivot point of sorts. This is obviously no easy task, but UCSF is a leader in so many other realms, and we've shown that we have the ability to create meaningful culture change in the past, and we think this can happen again. So what is this going to actually require? It's going to mean clear communication and guidance from leadership, and a discussion about how we can uncouple travel from professional advancement, which is really a major driver of our travel here at UCSF. And we need to continue thinking about how we invest in resources that facilitate virtual engagement with our colleagues in meaningful ways, whether that's across the city or across the world. And then we need to encourage our partners at other institutions to think about how they engage with travel as well. And that means encouraging the academic communities and societies that our faculty, staff, trainees, and students are a part of, to design meetings in ways that permit virtual participation. And that way, those who choose not to travel or are limited due to cost, visa restrictions, or other personal or professional obligations can continue to participate without feeling this overwhelming need to travel. And by doing this and keeping equity, inclusion, and environmental justice in mind, we think that we can both expand the diversity of voices and ideas that are heard within this academic discourse, and also meaningfully reduce our impact on the environment.
Great, thank you, Stephen. John, you want to go next?
Yeah, sure. I think if we, what we maybe would have done differently if we, at the start of all of this again, our building turndown effort, I think we would have started the planning process sooner and ensured that we had all the right people and stakeholders at the table, and also planning for longer term shutdowns. I think when we started, we didn't realize how long remote and telework would last. I think we could have probably spent more time planning and been a little bit more aggressive with our turndown. Like many departments at the beginning of COVID, there was a lot of uncertainty. Things were changing and developing quickly, and the safety and health of our occupants was a top priority. So if there was any concern or uncertainty with a certain area or building, we tended to cross it off the list beginning. But I think looking back, there probably was some opportunity that we could have investigated further and safely turned down those spaces. Another thing is getting department leaders or representatives at the table early to educate them about our efforts. I think later on, after our initial effort, there was a lot of discussion around consolidation, and there still is a lot of discussion around consolidation. And our team completed some analysis, and we think we can get deeper energy savings. The idea there is, instead of having a few people work on one floor and another few people working on another floor, if we can get them all to work in the same buildings or in similar on the same floor, we can be more aggressive and either turn down buildings completely or also turn off floors completely and get a lot more energy savings there. So we actually think that's a great opportunity going forward with potential, I guess, a future hybrid model for telework and on-site work in terms of consolidating spaces. Lastly, I think this really highlighted the importance of our building system controls and automation. Having smart control systems that can quickly respond to our changing needs and turn off equipment, change ventilation rates, and adjust heating and cooling set points really makes us agile and responsive during these uncertain times, and also saves us energy during our normal operations. And in terms of automation, automatically shutting down systems during unoccupied periods, whether that be lighting, heating, cooling, and ventilation, and ensuring we have the right technology, such as motion sensors and CO2 sensors to detect occupancy and automatically turn down or turn off buildings. And we do have a lot of controls and automation, and our team has done a lot of great work, especially on our Mission Bay campus and our newer buildings. However, there's certainly some opportunity to invest in controls and automation, especially in our older buildings. And the end goal really would be during periods of low occupancy, having everything turned down automatically, and of course, while still meeting all the health and safety requirements. I think that's what I have for that.
Okay, great. Thank you, John.
Of course.
Linda?
Yeah, great question. So shortly after the pandemic hit, not only did we turn our attention to supporting our outpatients with video visits, but because we had visitor restrictions in the hospital, we developed a hospital video navigator program that would let our inpatients stay in touch with family members and other loved ones through facilitated Zoom meetings. We have a hospital video navigator who reaches out to the family, make sure they're set up with Zoom on their devices, and who works with the care team to make sure that a device is placed in front of the patient, schedules family visits. They're also used to schedule care team family interaction. And as restrictions have sort of been reduced and we're returning to normal inpatient operations, that service is still widely utilized. It's turned out to have a ton of advantages that we didn't anticipate. It's got a serious equity component because the patients it serves the most are ones who can't bring a personal electronic device with them for their inpatient stay. And we're finding lots of clinical opportunities. Patients will have family members participating via video at the bedside during physical therapy sessions or when they first ambulate, or patients who are resistant to eating will do a Zoom meeting with their family while their family's eating. Or patients can spend time with visitors who are very far away from the Bay Area, who would never really drive here. So it's definitely reducing travel, right? Because families aren't coming to the hospital as often, but it's also got this clinical component that I don't think we anticipated, and this equity component. And we could have started that years ago, right? That didn't need a pandemic, and I think we would have gotten moving on that front a long time ago if we had a crystal ball.
Yeah, thank you, Linda. Thank you all for your very thoughtful answers. Let's be sure that we utilize these lessons learned to be ready for the next crisis. So I'd like to thank all the speakers for their insightful and fascinating presentations. I hope that you learned something new today, and I hope it sparked ideas and interest to learn more and to do more. So we may have a time for one more question. Rowena, do you have a question that we could share with the panelists? Okay, so we had a question for Alicia. So if Alicia can come back on.
Here I am.
There you are. Okay. So UCSF office reported 58% of total emissions come from burning fossil fuel. Are there any plans to retroactively electrify other existing UCSF buildings other than the Tidelands so that UCSF can cease burning fossil fuels at the cogen plant to generate more of its power and heat?
So we don't have a specific concrete plan to go back and retroactively electrify buildings today. However, we have been focusing our time and energy on the revitalization of our Parnassus campus. So I think that's really a good thing to think about, maybe not at the building level, but certainly at the campus area systems level. Where could we look to move away from fossil fuel and move towards electrification? I think that would have a big impact, and it's right in our focus of the Parnassus revitalization. So it's a great suggestion. And right now is the time to start looking at it.
Great, thank you, Alicia. Okay, we have another question regarding Anne-Marie. So Anne-Marie, can you come on? The comment was, I like the research that was presented from a report that was mentioned around harmful chemicals related to fossil fuels. Is there a link available to view that report? And we can put it in our on our website if you can send it to us. And we'll post it all on our website by Friday, and hopefully we can do it there. But Anne-Marie,
Yes.
make a comment?
I did. I just actually was responding to that and put a couple of links in the Q&A, but I'll make sure that I can give them to you offline too as well, Gail, as references for the information I provided.
Okay, great. And one more question, I think for Alicia. Does UCSF have any plans to make it easier to commute to campus by bike? For example, subsidies to bike share memberships.
So yes, we're just about to launch our bicycle and micro mobility campus planning effort. And I expect that we'll have many recommendations come out of that, both on how to encourage operationally, like providing some fiscal incentives, as well as the physical infrastructure, sometimes really simple things like a place to safely and securely park your bike, to really support people getting out of their car and using alternate fossil-free means to commute to work.
Okay, and there was another question, I don't know, it's about Lyft bikes. I don't know the answer, but why did UCSF end the program with Lyft bikes for getting employees a discount? It's important to encourage biking as a form of transportation.
So Gail, I think we're going to have to follow up with our transportation colleagues and perhaps answer that on the website Q&A, because I don't have a ready answer for that either.
Okay, yeah, okay, we'll do that. So thank you for all the questions from our audience. And before we conclude today's town hall, we do have a call to action. So one of the big things that we've been focusing on is Energy Star appliances. They are so much more efficient than conventional. So for campus and home, we encourage everyone to focus on Energy Star appliances and electronics. And then reduce air travel as much as possible. Maybe avoid a trip that you had planned or hoped to plan and do a local trip instead. The third is take transit, carpool, vanpool, or telework, telecommute. That makes a significant difference, and we've already seen that difference on campus. Or if you have to come to campus, drive an alternative fuel vehicle. And we offer discounts on electric vehicles, so check with our website to find out more about that. And because of telehealth and the huge benefit that it's provided, we encourage everyone to use telehealth as possible and really to reach out to those decision makers who could help promote continued telehealth. Would be a great suggestion and support that we can get for that. And that concludes our presentation for today. And I want to thank all of our presenters and attendees. And we will post this recording, and the questions and answers will be posted on our website. So if you go to sustainability.ucsf.edu, on the home page, we will have the main story on a carousel. We'll have all this information that you can go back and take a look at. So thank you again for everything, and we hope to see you another time. Thank you very much.